And then you couple this with the healthcare exchanges, who gets covered and who doesn't. The front page of the New York Times today, major piece, millions of poor are left uncovered by health law. Choice by states not to expand Medicaid undercuts reach of Obama plan.
I mean, one of the interesting things is that the GOP is saying that this is about Obamacare and want to shut down the government because of Obamacare. But the GOP largely has defeated Obamacare in a lot of places in the country. And that's because, as the Times point out, as I've written about, as you just said, that
you've written about it well before this.
I did. I did. That half of the states are in the United States aren't participating in Medicaid. Overwhelmingly, they're in the South, where half of people of color live in this country, black people, and also Latinos. The second largest state in the union that with a Latino population is Texas. It's not included. And so it's leaving a lot of people behind. And so they say that they want to roll back Obamacare, but through stopping Medicaid, they largely already have.
I mean, it really is astounding. The 26 states that have rejected the Medicaid expansion are home to about half of the country's population, writes the New York Times. But about 68% of poor, uninsured blacks and single mothers, about 60% of the country's uninsured working poor are in those states. Among those excluded are about 435,000 cashiers, 341,000 cooks, and 253,000 nurses' aides. Trudy Lieberman, you've also written extensively about the whole, not only the Affordable Care Act, but just who gets covered and who doesn't, because you have to include those who are going to be cut off of Medicaid expansion when they don't get Medicaid expansion in their state.
Right. The irony right now is that the poorest of the poor are going to be left out of this expansion of health care. And it's, as the Times points out, it's affecting a whole lot of people at the very, very bottom of our income and our work spectrum. And these are the people who are usually have incomes below the federal poverty level. They have very erratic work histories, work jobs, and so forth, and they really have no options for getting health insurance. And the Obamacare, the Affordable Care Act, had contemplated that they would be part of this Medicaid expansion. So when the 26 states decided not to expand, there were provisions for people between 100 and 138% of poverty. Arguably, they have low incomes too. But ironically, the people below 100% are not going to get help. And they have no money to buy expensive health insurance. And in most of those states, I think it's worth noting that the Medicaid programs that do exist do not offer benefits to childless adults. And that is especially true in places where they have huge numbers of people in these populations.
And when does the states that have decided against Medicaid expansion, when will people be affected?
They're actually already being affected because they're effectively now not under the insurance tent, and they have probably never been. And so on January 1st, it was contemplated before the Supreme Court ruling last year that they would be brought under it, and they're not going to be.
Amara Jones, you were in the Clinton administration when a previous shutdown happened in New York. I remember the famous image of the New York Post of Newt Gingrich, as a baby having a tantrum because he was very upset that he was put at the back of the Clinton plane. And, of course, in the end, they were forced to back off, the Republicans.
That's right. That was actually my very first job, and I had probably been there, I don't know, a couple of weeks. And one of the most interesting things is the degree to which it is incredibly disruptive. It takes maybe, from the shutdown that lasted 3 weeks, it took maybe 8 or 9 months for the federal government to sort of really pull itself together and to stand itself back up after a 3-week shutdown. And this is more dramatic because at that time, half of the government was shut down because they passed half of the appropriations bills. This is now the entire government. And who knows what collateral damage we are causing by shutting down the government. For example, example, the Centers for Disease Control is in the midst of their flu vaccination campaign to vaccinate millions of the most vulnerable to prevent the spread of the flu. Well, one of the interesting things is that because of the government shutdown, that program is now been halted. And as a result, there's a distinct possibility that the longer this goes on, that we won't have vaccinated millions for the flu and maybe setting ourselves up for a flu epidemic. And that's just one. That's just one of the most obvious. And there are countless examples of that.
We're going to break and then come back to this discussion. Our guests are Imara Jones of colorlines.com and Trudy Lieberman of the Columbia Journalism Review. We're talking Affordable Care Act. We're talking about who gets insurance, who doesn't, and we're talking government shutdown. Stay with us.